accepted that cannabis clearly does increase the risk, but its impact on the development of schizophrenia, some say now, is not as great as previously feared.
Okay, so there's some evidence that it might increase the risk, but it's not necessarily going to lead to schizophrenia.
That's right.
Are there any other risk factors that might contribute to the development of schizophrenia?
In theory, any environmental stressor or significant life event can trigger the development of schizophrenia. Factors such as social adversity, social isolation, migrant status, and in fact urban life as well. There are many different factors that are associated with an increased risk.
In the past, schizophrenia was known as a functional illness because it was thought that there were no actual changes in the brain. But I know that now we've got a lot more advanced tools to investigate brain structure, things like neuroimaging. And I just wondered if you could say anything more about the structural brain abnormalities that are found in schizophrenia.
Yes, there have been many studies that use structural imaging techniques, such as CT or MRI scanning, that show consistent abnormalities in people with schizophrenia, including decreased brain volume, particularly of the frontal and temporal lobes, thalamus and white matter tracts. Enlarged third and lateral ventricles is a common finding. Small and medial temporal lobes, decreased cortical grey matter and reduced cerebral asymmetry are other common findings.
It sounds like there are quite a lot of macrostructural changes then. How about on the microstructural level? Is there any evidence to suggest that there's anything going wrong in terms of neurochemicals in the brain?
Yes, the main neurochemical implemented in schizophrenia is dopamine. This was originally actually due to the accidental finding that phenothiazine drugs, which block dopamine function, reduce psychotic symptoms. Another factor which supports this dopamine hypothesis is that amphetamines, which trigger the release of dopamine, can induce psychotic symptoms in healthy individuals and those in schizophrenia, as I mentioned earlier. In addition to this, all antipsychotic drugs are dopamine receptor antagonists, and or at least interact with the dopamine in a modulating fashion, as some of the modern drugs do. And there's been a good study showing that affinity with the D2 receptor correlates with clinical potency of the medication.
It sounds like dopamine is then a very important chemical in schizophrenia. Are there any others that are also important?
Yes, more recently glutamate has been found to be involved, in particular the NMDA glutamate receptor. Antagonists of this NMDA receptor, such as ketamine or phenylcyclidine, or PCP as it's more commonly known, can induce a schizophrenia-like psychosis.
How would you actually go about diagnosing schizophrenia?
Well, I think it's best that we focus on the subtype of paranoid schizophrenia here. There are other subtypes, including hebephrenic and catatonic, but these are much less common.
Okay, so we'll focus on paranoid schizophrenia for today.
Okay, so if we use the World Health Organization's ICD-10 diagnostic criteria, then you would need specific symptoms for at least 1 month. This is opposed to the American DSM system, where you would need symptoms for at least 6 months for a diagnosis. So, taking the World Health Organization, the ICD-10 criteria, which is what we use here in the UK, you need either 1 primary symptom or 2 secondary symptoms for at least 1 month.
And what are the primary symptoms?
Primary symptoms include thought echo, thought insertion, thought withdrawal and thought broadcast.
Can you explain what these are?
Well, first of all, dealing with thought echo, this is the perception that your thoughts are being heard out loud, so that's actually a hallucination. Moving on to thought insertion, withdrawal and broadcast. Thought insertion is the belief that somebody else or something else is inserting thoughts in your head. Thought withdrawal is the belief that somebody or something is taking thoughts out of your head. And thought broadcast is the belief that your thoughts are being broadcast, a bit like a radio, into other people's heads.
Okay, and are there any other primary symptoms?
Yes, there's quite a list. Next, there's delusions of control, influence, or passivity. These are beliefs that somehow you are being affected by an external agency or someone else. So you believe that you're being controlled, your movements are being controlled, your thoughts are being controlled, your emotions are being controlled somehow, maybe telepathically or by some other method.
Are there any other symptoms?
Yes, delusional perception is a primary symptom, and this is an interesting symptom which is thought to occur at the onset of a psychotic episode, where you have a normal perception that's followed by a delusional interpretation of that normal perception.
Can you give me an example of delusional perception?
An example of this might be seeing a red car, for instance, when you walk down the street, and then coming to the belief that seeing the red car means that you're being followed by the MI5, for instance.
We've covered quite a number of primary symptoms. I'll just run through them. So it's thought echo, insertion, withdrawal or broadcast. Also delusions of control, influence or passivity, and delusional perception. Are there any other primary symptoms?